Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
In today's Health Matters, we are joined by Dr. Joy Bradley, an assistant professor in community medicine and population health at UA. And today she's going to talk about midwifery. Thanks for joining us today, Dr. Bradley. So what can you tell me a little bit about the backstory of midwifery?
So midwifery was actually the norm around the 1900s in the United States, and especially in Alabama being a more rural state. And eventually, as obstetrician kind of grew as a discipline, more and more women started to go to the hospital to deliver. And so as that happened, when that transition happened, midwives were actually outlawed in the state. And so that practice and that awareness about what midwives can do was kind of lost at that point.
So coming forward till today, why are they important now?
So midwives actually are important because it's really crucial that birthing people and families have options when it comes to how they want to bring their children into the world. And so there is no right or wrong way to kind of do that, but it is helpful to have the option. And what we know is that, we spend the most money as a developed nation on healthcare, but we continue to have the worst outcomes. And so when you look at other developed nations and you see what their models are and what their options are, it only makes sense that we have that equal opportunity for the people that live here in our country.
I think you mentioned earlier that still in Europe, this is really big still.
Yes. So about 60% of births are attended by midwives in some of the developed nations. And so it just makes sense that we have those options available for our families because we want to ensure that they have the best outcomes and that they have an active role in how they want to deliver their babies.
And this is still maybe a problem here because we're in such a rural area and hospitals are not always available.
So again, I just think it's an alternative option because midwives do typically attend births in home, and so you would take away that barrier to transportation or just to even having a hospital there. And then there's also just the idea that there's birthing centers that can also provide that care and that service, and so it's now I think the state of Alabama has about 3 options for birthing centers here, but more we can continue to grow that resource and that service, I think, and that might be one of the answers that we have for some of our more rural counties.
And don't they have a big job after birth and postpartum?
So the job doesn't stop after postpartum, and some would say that's the most dangerous period for women when you think about maternal mortality. And knowing that Alabama has a very high rate of maternal mortality, again, it just makes sense, and it should be something that we should be really fully invested in to have it as an option.
Yeah. So what would be kind of some of their daily jobs to go through?
So I am going to actually leave that answer to my counterpart, and she is actually a student midwife, and she can kind of talk to you about, what are some of their daily tasks and responsibilities as a midwife.
Absolutely. Was there anything that I haven't asked that you would just like to add?
Yeah. So a lot of people ask me, what's the difference between a doula and a midwife? Mm-hmm. And so I just want to offer that clarification. So doulas are non-medical support, and so they are there to offer physical comfort measures. They're also there to provide, additional education and make sure that the birthing person knows what's happening to their body and how to respond to certain things. They also help with birth plans, so they help the birthing person and that family prepare for that birth, and the more you're prepared, the less anxious you are. And so they also provide a lot of social support because the unfortunate reality is there are a lot of people that are going through this experience alone, and they don't necessarily have the resources and the support to kind of get them to where they need to be. And so doulas provide a great opportunity for that. And whereas a midwife is the actual medical provider. So they can actually deliver the birth, they can attend those prenatal appointments, and they can take care of mom and baby after delivery.
So why did we stop doing this?
So that's a very highly political, and not necessarily even political, but as far as history is concerned, again, there was a shift that occurred, as obstetrics became more popular and more in demand, and it became more of the norm. Midwifery was just decentered from that model of care, and eventually it became illegal to actually practice. And so over the last, I would say 10 to maybe 10 years, Alabama has changed their laws to actually allow midwives to practice. And so we do have the opportunity to have that option for moms here in Alabama now, and I'm really, really excited about it.
Yeah, so what do people need to know about that? What are kind of the options?
So the biggest option is, as far as the price is concerned, right now they are not covered by insurance, and so that provides a lot of barriers for folks that are looking for that alternative form of care. And so you do almost always have to pay out of pocket to have that experience. And so there's a lot of policy that needs to kind of shift and change to allow for that to be a covered benefit to folks. And so I think that would be like the biggest thing to think about, is making sure that we make it an affordable option for families, especially the families that experience the most disparities.
Yeah. Does it help in cost at all versus a hospital, or is it about the same?
So that is an interesting question. I'm not as on the financial and economic side of things to know how to answer that question adequately. But again, I think it's very policy driven, and so the more policy we have behind it, the more we can make it work. And then it just depends on if you have that midwife practicing in the hospital, that is also an option, versus the home birth versus a birth center. And so those are three very different models, and so the cost is going to be dependent on where you're at, what setting you're actually in.
Yeah. Is there a difference in births really being successful or unsuccessful with a midwife, or?
So midwives typically follow low risk births, and so as long as you're considered to be low risk, then you wouldn't necessarily have to worry about like having anything come up that you wouldn't be prepared for. And so I think that just making sure that you're aware of what your risks are and having that plan. Even if you have an obstetrician, that doesn't necessarily mean that you have to do either or. Some families choose to have a midwife and an obstetrician to work with them, and so you just kind of have to know what your goals are and how to move accordingly.
Absolutely. Well, thank you so much. Is there anything else now that I haven't asked?
No, I would just say that I think it's really important for birthing families to, again, know what their options are and to make the decisions that are going to be in the best interest of their families, and to have the outcomes that they deserve to have. So I am going to leave it up to Jamila to kind of fill in the gaps and to give a little bit more details about what midwives do.
Well, thank you so much for joining us today.
Thank you.
And now we're joined by Jamila Channel, a student midwife and certified doula, who's going to give us a little bit more in depth about what it means to be a midwife. So thanks for joining us today. Tell me a little bit about what a midwife does.
Yes, a midwife is an actual medical professional who delivers babies, provide prenatal care and postpartum care, and also cares for the baby up to 6 weeks of age after delivery.
So what would be kind of some of y'all's daily duties?
So our daily duties are mostly like dealing with prenatal cares, the special thing about our prenatal appointments is they're typically about an hour to 90 minutes long. We spend a lot of time on holistic approach of care, so making sure that they're okay physically, mentally, emotionally. We do a lot of educating on nutrition, what to expect during that trimester, how to kind of bond with their baby, what's going on in their life personally and emotionally. So that is typically the bulk of our day. Of course, we have the fun of actually delivering babies. So working with moms through labor and then caring for them during postpartum.
So tell me a little bit about the differences between you and maybe going to a hospital.
Yeah, so our patients or clients are all low risk. So they don't have any pre-existing conditions or illnesses. They normally don't deal with like gestational diabetes or hypertension, preeclampsia. Those are more like high-risk patients, so they end up going to the hospital. So all of our clients are just basically pregnant. It's normal to be pregnant. It's a natural thing. So those are the clients or the patients that we work with mostly.
How do you think this kind of helps the area?
So currently, we are considered a maternal health desert. So our midwives are able to actually go to the home to deliver babies. So that's one way that we can kind of combat that issue. Also, they are working towards building more birthing centers. We currently have 3 here in the state. So just a safe space for them to be able to go and deliver their babies naturally.
So tell me a little bit about what is a birthing center?
Yes. So a birthing center is a space that is almost like a home. So you go in, there's furniture like you're at a house, there's a bed, there's tubs, there's a kitchen for you to like cook your dinners and your lunches. And it's just literally a space for families to come, deliver their babies, and then after 4 hours, they're able to go back to their homes.
In your own experience, how does this kind of help the mothers?
It empowers them. It feels like something like society tells them, oh, you can't have your baby naturally, or like the pains are unbearable, you need to have an epidural. But our moms are able to kind of tone into themselves and mentally prepare themselves to handle the contractions, the intensity of contractions, and deliver their babies. So it really feels empowering. Also, not breaking the physiological cycle of birth makes a big difference in their healing process postpartum. They suffer less from postpartum depression, and also their breastfeeding rates are higher because they start to lactate milk as soon as baby is born.
So there are some major differences.
Yes, and it's basically because they're in a safe environment. They're in their homes or they're in the birthing center where they've come and spent hours before it's time for them to deliver. They know the midwife because you go in. The same midwife that you do your prenatals with is the same midwife you're going to do your postpartum with, your birth with, breastfeeding education with. So you're with that person for 9+ months, that same person, compared to when you have OBs or at a doctor's office. You might go to a practice where doctors are rotating in and out. You go to the hospital, nurses are rotating in and out of shifts. So it's not a cohesive or continuation of care with the same provider. So that creates a safe space and comfortability for them to like really relax and open up with their provider.
Absolutely. How does this kind of help here in the rural areas?
Yeah, so I think it helps them by, one, providing a safe space or a safe person for them to actually birth with. So even though they feel like they don't have a hospital that's in their area, they know that they can call their midwife to be able to come meet them either at their home, or the midwife will find some kind of resource for them to get to the birthing center for them to be able to birth their babies. I think the biggest thing about that is that midwives work really hard to make sure that their patients or clients have all the social economic resources they need as well. Yeah. So if they need food, we find resources for food. If they need transportation, we'll find resources for transportation. If they need counseling, we'll find resources for counseling. They could bring their children. So we try to break down all the barriers that prevent them from getting prenatal care to make sure that they get the care they need.
Absolutely. So talk a little bit about what y'all do postpartum and how many weeks y'all go from there.
Okay, so postpartum, Every midwife can vary, but typically it is 6 weeks of postpartum care. There are some midwives who specialize in extended postpartum care, so maybe they go from 6 weeks but all the way up to like 12 and sometimes the first year of life. But what they're doing is basically checking to make sure that the mother is not bleeding too much. They are checking blood pressure to make sure that her levels are stable. They're checking to make sure that she's healing well. They're checking to make sure that breastfeeding is going good. And then they're also doing the care for the baby as well. So typically here in Alabama, it's up to 6 weeks of care for the infant before they have to transition to a actual medical doctor or a family physician, pediatric care for the infant. So they will make sure that baby's gaining weight, make sure that the baby is like stretching out their length and they're developing well, like there's no like popping in their hips or like their stomach as well. They're breastfeeding, they're latching well, tongue ties, lip ties. They're checking all of that. They actually do hearing screens to make sure that baby has their hearing screens as well. Checking for jaundice levels to make sure that the baby is not having jaundice. The same thing they would do with a OB or with a pediatrician is the same thing that a midwife does as well.
So why did you go into this field?
I love the idea of working with women in their natural state and just seeing how empowered they feel after they have delivered their baby naturally. I personally had a natural delivery with my daughter, Naima, and it changed my life forever. It made me feel like I could conquer the world. So being able to provide that experience for other women is what I want to do, because I feel like you can internalize that feeling and take it anywhere with you in life and be successful at all things you do.
Well, is there anything that I haven't asked that you would like to add?
I want to talk about two things.
Okay.
So the number one thing is I want to talk about the birthing center options here in Alabama and also where they can find midwives here.
Yes.
So we currently have at WAWC, or West Alabama's Women's Center, we have Nancy Megason, who is a certified professional midwife. She provides midwifery care there, and she also offers home birth right here in Tuscaloosa. We also have Dr. Stephanie Mitchell, who works at the clinic as well, but she has her own birthing center in Gainesville, Alabama, called the Birth Sanctuary. She is now accepting clients where they can come and actually birth there. The sanctuary is absolutely beautiful. And then we also have Oasis Birthing Center in Birmingham, Alabama, who the midwife there currently is Devin Collar. And these midwives are absolutely amazing. They're all my preceptors, so I get to work hand in hand with them while I'm learning. So if people are actually looking for midwifery care, they can come to these different areas. And like Dr. Bradley said, a lot of times you are able to do midwifery care as well as OB care. So let's say that you have like gestational diabetes or you are showing signs of preeclampsia. You can still see your doctor for those high risk issues, but you can get the holistic care with the midwife. They can still talk to you about your nutrition and emotional health and really like bonding with your baby. So you can compare or make those two providers compatible for your well-being of your pregnancy. Yeah, and then the other thing I wanted to talk about is the difference between a certified midwife and a nurse midwife. Okay. So a certified nurse midwife, or CNM, is a midwife who provides care in the hospital under the guidance of an OBGYN. So here in Alabama, currently, University of Alabama, UAB, provides midwifery care there. So if you wanted to get an epidural or you wanted to get some kind of pain medication, but you still want to have that feel of working with a midwife, you would go there and be seen by a certified nurse midwife. Okay. If you wanted to have a home birth, no medication, just a natural birthing experience, then you would work with a certified professional midwife. So these are the midwives who birth at home and also in the birthing center. Yeah.
I feel like a lot of options that I had no idea existed.
Yes, there's a lot of options. Yeah.
Well, thank you so much for joining us today.
Of course.